The general, diet, physical or spiritual is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Good afternoon. Hello and good evening to all our listeners and viewers. Assalamu alaikum to our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. For some bizarre reason, we have some technical difficulty in the starting, and instead of saying that this is a live show, it says that this is recorded. Well, I can assure you this is not a recorded show. I'm Fahad Matin, your host for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I pray that we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 28th of August 2025. Yes, it is 28th of August 2025, and the time just past 6 p.m. We are casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, and Bedford. Positive airways reaching all our listeners who are listening us across Luton and surrounding areas of Luton, and definitely listening us through Inspire FM app, website, and viewing us through Inspire FM Facebook and YouTube channel. As you all know, we always start our show with some of the music, but for some reason it's not on. But hey ho, it is what it is. According to NHS England, every day we around 140,000 people across England access urgent and emergency services, and including those who seen by urgent care treatment centres, ambulance services, NHS 111 and A&E departments. Of these, more than 11,000 are admitted to the hospital and onwards, but around 20,700 been seen are seen in ambulance services and by urgent care services, and this is the stats from NHS England. But and that's what we always try to do. We try to bring different health related topics, and today's topic is very different but very common, because we all have used urgent services in our life one way or another, either through 111 or through hospital when we end up in our lovely L&D and being transported over to the other side. But as we have seen the services, we thought now it is the time to get some insight about those details. So yes, you have heard me. You could have understood where the discussion is going through. So the topic for today, or the topic which we will be talking about today, is urgent care services, when and why someone should be utilizing. Yes, you heard me correctly. We are talking about urgent care service, when and why someone will be using it. Now, the good thing is, I'm not the one who will be talking about this topic by myself. I have two lovely guests with me in the studios who will be talking about this topic in detail and giving a light on this subject much better than me. Joining me today in the studio is Dr. Chris Griffin, who's the CEO of Milton Keynes Urgent Care Services, and Julia Cochin. She's the Director of Nursing from Milton Keynes Urgent Care Services. Good evening, guys, and thank you so much for coming today. How are you?
Good, thank you. Pleasure to be here.
Thank you so much. So one of the way we run our show is to ask our guests to introduce ourselves and give quick introduction and a brief history about themselves, that how you become what you become in the experts in your field. So let's start with you, Julia. Ladies first. So tell us about yourself.
Okay. Well, I've ended up at urgent care. Predominantly my background is accident and emergency and spent quite a few years working within prison health as well. Started off actually caring for patients with HIV in the late 90s, which was an interesting time. So predominantly my background is emergency care, and now I am Director of Nursing at Urgent Care.
Perfect. It is a very short introduction. I was thinking of...
Come on, nobody wants to hear about me.
I was thinking of you beginning a very long intro. Anyhow, Chris, you're next.
Thank you, Fahad. Yes, so I'm a GP by background, and I've worked in urgent care now for about 10 years, all in all, including my kind of training period. I've been in the chief exec position there for the last maybe 5 years. It gives the perfect blend of that kind of clinical and management involvement in the role. Other interests include musculoskeletal, sports medicine. I've got masters qualifications in those areas, but really urgent care is where my heart is. And when it's done well, it's done really well, and it has such a positive impact on the kind of surrounding communities. Again, quite short, but hopefully gives you a little bit of insight.
Indeed, and something I learned today as well, and this is the beauty of the show. There's always something I learn. I did not know you have expertise in MSK side. Otherwise, I would have come for my condition to you. Right. So normally at this note, I have music, and I'll normally bring our listeners. So let me call our listeners as well. Listeners, if you have any questions or queries, if you have any questions or queries regarding regarding our topic today, regarding urgent care services, please get in touch with us by calling us on 01582 481822. I repeat, 01582 481822. Or you can send us questions via 0779 481822. I repeat, 0779 481822. Now, one of the things which I always wanted to ask, what are urgent care services and how do they are different from the A&E services? Chris?
Well, it comes effectively, the clue's in the name. I think if you look at it from the perspective of urgent care, what we will be encouraging away from our service to the emergency services are emergency conditions. So that may include, suspected heart attack, suspected stroke, really unwell with shortness of breath, etc. Effectively, conditions that sit within that category, meeting that kind of emergency profile, certainly should be in the emergency department. And then also looking at it from the perspective of kind of general practice, where there are certain requirements that the GP would have, repeat medication, chronic disease management, or managing symptoms that have been present for a little while. Again, that would be kind of directed and navigated down the GP route. That's best placed there. So at urgent care, we're kind of in that middle ground. So we don't want to see patients that are critically unwell. They need to be in the emergency department. But if you are in a position health-wise where you find yourself perhaps needing to see a doctor on the day, then that's where we come in.
Mm-hmm. So people who are not sure whether they should go to A&E or should come to urgent care, what do? Do they call 111, 999, or just end up on the A&E dose?
In the first instance, there's a big push now to call 111 or go 111 online. The navigation tools within that service will effectively steer you to the right point of contact. In the event of an emergency, central crushing chest pain, weakness in a limb, facial drooping, slurring of speech, etc., then of course, yes, absolutely go straight to the emergency department or call 999. But if it's not an emergency and we're more so kind of needing advice or steer on where to present, then absolutely 111, either online or via telephone, would be the best and most appropriate first point of contact.
Right. Okay. So, when should a patient consider to go to urgent care services instead of their GP or A&E, Julia?
I think just excuse me, reiterating what Chris has just said, really. I think sometimes it's also very difficult in the current climate because all services are incredibly under pressure. And we all know that, GPs are really feeling that pressure. So things that you and I in the past would normally think, well, I'll ring up and book an appointment. You get in that 8 o'clock queue in the morning and you're 47th in the queue. And we do have a lot of people then deciding to walk into urgent care to come and see us for some advice. And that's okay, I think. I don't think Chris would disagree with me on that, but because obviously I think especially during COVID, lots of people sort of squirreled themselves in their own houses because they didn't want to go into healthcare establishments, and so things just progressively got worse and worse, and we were finding people presenting with much more acute problems. So I think, we would all say we would rather, if you can't get in to see your GP with something that you think is a relatively minor illness, rather than just sit there and feel unwell, we would rather people present it to us. Ideally, do ring 111 though, because there are other routes that also might be appropriate for you to take, which might save you some time, actually, at the end of the day. But, I think if in doubt, either ring 111 or, again, if you're finding that, callbacks are quite lengthy and you're worried, just present to us and we will steer you in the right direction if coming into us isn't the most appropriate course of action.
Mm-hmm.
But the one thing urgent care we do is we never turn anybody away. We may give advice, but we will always offer clinical advice and we will always offer people to be seen.
Mm-hmm. So in terms of the types and conditions that can be treated, what types and conditions people can come to urgent care to get treated if they have to? Chris?
That's me.
Yes, it's you.
So, if we try and kind of categorize them into varying areas, so musculoskeletal injuries, sprains, strains, etc. That may be in a limb or that could be in the back. We see a lot of back pain presentations, but categorizing injuries or musculoskeletal ailments, and then also we see a lot of minor illness. So again, that will include things like sore throat, ear infection, chest infection. We see a lot of urinary based infections. We also see minor injuries, so that can be lacerations, cuts, grazes. We manage a lot of burns at Milton Keynes Urgent Care Centre. Fever, so fever again in children and in adults. We see an awful lot of, and along with a lot of skin conditions, so allergies, bites, stings, etc. I think that's a bit of an umbrella, but covers lots of things.
So children's as well.
Indeed, indeed. So we see a lot of children with fevers.
Because I remember being a father myself. It's always hard to take a crying child to an A&E and then wait for 3 hours, 4 hours, especially on the nights. And that brings me to another one. Are urgent centers are 24/7, so do they have a specific opening time? And I'm talking about generalized all across the UK.
So it really varies, and at the moment, there is taking a step back. Urgent treatment centres are becoming kind of more recognised and increasingly standardised. So if you turn the clock back even 5 years, you'd have centres called minor injury units, urgent care services, urgent treatment centres. So the leap forward now is to try and standardise the terminology, standardise the care. So we're kind of approaching it as urgent treatment centres. The general guidance is that all urgent treatment centres should be open between 12 to 16 hours. In Milton Keynes, we're open 24/7, but that's not the case for all centres. Again, in terms of accessing these services or knowing when they are open or closed, the best point of contact does still remain 111, and then they'll navigate on what services are available at that time in your location.
Okay. So, how can people of Luton and the surrounding areas, which is within the BLMK Centre, access or find their nearest urgent care services? Julia?
Again, exactly what Chris has just said. The best course of action is to give 111 a ring, and obviously they're there 24/7 as well, 365 days a year, and they will guide you as to your nearest centre and give you the exact location. So that's by far the best way. If you're wondering where your nearest centre is, or if your centre's open, then that's always the best course of action.
Okay. On this note, let me introduce our listeners as well. Listeners, if you have any questions or queries regarding our topic today, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions to us via text messages or WhatsApp on 00779 481822. I repeat, 07779 481822. And people who are listening, who are seeing us through Inspire FM app or through our social media channels, WhatsApp or Facebook or YouTube channels, you can ask questions over there as well. One of the questions says, should a Muslim pray to Allah to go to doctors? Well, hopefully not, but then again, if there is a requirement to see a doctor, you can always go to a doctor. Yeah, that's a very awkward question. It says, should a Muslim pray to Allah or to go to a doctor?
Well, I think as clinicians, our advice would always be to do both, probably, but certainly go to a doctor. I think.
Oh, yes, because at the same time, it is part of it has been said in Islam as well that always do prayers as well, to pray to Allah as well as take necessary medication if needed to be. Anyhow, coming back to our topic, how do urgent care, using the urgent care really reduce waiting time for patients or to see for emergency treatment?
Yeah, so again, it's the appropriateness. It's trying to kind of navigate and direct patients to the most appropriate service for their medical needs. So again, taking the step back and thinking, do I have an emergency medical problem right now? If the answer is no, then steer away from A&E. And what that does is it reduces overcrowding in the A&E department. It will reduce waiting times in the A&E department. And therefore, you'll have emergency clinicians that can best treat individuals that do need emergency intervention. So it's there as a preventive and a protective factor, really. Hence why we have urgent care centres available. It's that kind of step down from the emergency department, so the emergency clinicians can really manage emergencies.
So when we talk about urgent centres and A&E hospital times, so the urgent care centre, does it reduce pressure from A&E side by seeing patients? Because I remember there are times when people end up in the hospital A&E department and then they send patient to seen in urgent care services. So is that what happens sometimes?
Yeah, so there's the term that that's used kind of within the NHS is streaming. So if you were to present to the emergency department there's generally a clinician that will meet you at the door, take a very brief history, and can kind of direct you to the most appropriate service. And that really is so that patients, again, that need emergency care can receive it, or those that need primary care can receive it through their GP, or of course urgent care. All A&E centres will have these streaming processes in place, but effectively going through that 111 service prior to presenting, if it's not an emergency, then again that navigation process almost takes place before you get to the front door of A&E.
And in terms of the families, as I was asking earlier, we were discussing about the children's briefly. How can families, especially with the young children's, know when urgent care is right option for them, or the hospital right option for them? How do the families or the parents know that coming to A&E urgent care is a better option, or calling 111?
I think that there are some red flags that are appropriate, that stand in good stead for children and for adults. I think that there's a lot to be said as well about parental intuition. I think that the rule, especially in the out of hours period where you can't get in touch with your GP, is that if you're at all worried about your child, again, ring in 111. If you think it's immediate and life threatening, then obviously you would ring an ambulance or take your child straight to the emergency department. But I think that if you have any doubt, or if you think that your child does need to be seen, then you need to get them attention, but you don't think that it's something that's immediate and life-threatening, then obviously you can always bring them in and walk into the urgent care centre, and we will assess them and see them. So I think that there are red flags with children, that you can always, a very high fever that's not coming down with any kind of over-the-counter use of Calpol or Griffin. If your child hasn't passed urine for a significant number of hours, if you think your child's becoming dehydrated, if your child, the typical meningococcal signs and symptoms to look out for, so stiff neck, funny rashes that would appear. So any of the list is quite vast, but I think the overwhelming message, and Dr. Griffin may well want to add to those clinical symptoms, but I think from me, the overwhelming message would be, if you are worried and you don't think your child can wait, then either ring 111, come to us, or if you're really worried, take them to the emergency department by whichever way you can get them there. I don't know if you want to add anything to that, Chris.
I think that really is really is quite clear. No, I think the biggest, whenever I see and treat parents, the children and then their parents, my kind of discharge advice is always around, as you've highlighted, fever control. I mean, fevers are so common, and it's not so much the height of a fever, but it's how well it responds. And even having said that, fevers can still be quite stubborn, even with viral illnesses. But if the fever's not responding, usually we'd expect a reduction by at least a degree, following a dose of Calpol or ibuprofen. So using that as a measure is generally usually a good sign. And of course, parents know their children better than anyone. So
Indeed. When it comes to appointment, I know it's not easy to get GP appointments nowadays. And wow, on that note, I must say we're about to go on a very quick break. So when we come back from the break, I will definitely want to touch bases on GP appointments versus urgent care, as in when people come to urgent care. And definitely there are some other topics I do like to know about, the role of 111, which we have touched earlier, and some of the services, how we can reduce and support our community in terms of this whole services. So when we come back from the break, we will talk all about it. So stay tuned, and we will come back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Abu Hurairah radiallahu anhu narrated that the Messenger of Allah sallallahu alaihi wasallam said, "Whoever relieves a Muslim of a burden from the burdens of the world, Allah will relieve him of a burden from the burdens of the hereafter. And whoever covers the faults of a Muslim, Allah will cover his faults for him in the world and the hereafter. And Allah is engaged in helping the worshipper as long as the worshipper is engaged in helping his brother."
Greystone Solicitors are committed to protecting your rights and fighting your corner to ensure you get the best possible results. Specialising in immigration matters, employment issues, family matters, personal injury, medical negligence, civil litigation and housing. Need help with your immigration problem? Greystone Solicitors provide free immigration drop-in clinics every Friday. Call Greystone Solicitors today on 01582 343 453 or visit us at 275 Dunstable Road, Luton, LU4 8BS and begin your journey towards justice today.
लुटन फैमिली हब्स में हम माँ के दूध के हर कतरे की बहुत कदर करते हैं। चाहे आप ब्रेस्ट फीडिंग का सफर अभी शुरू कर रहे हों या काफी आगे निकल चुके हों, हम आपके साथ हैं। हमारी ट्रेन टीम और वॉलंटियर्स लोकल ब्रेस्ट फीडिंग सपोर्ट और सोशल ग्रुप्स में आपको रहनुमाई और हिमायत फराहम करते हैं। फ्री टू फीड कैंपेन का हिस्सा बनकर ब्रेस्ट फीडिंग को पब्लिक जगहों पर आम बनाने का पैगाम फैलाएं। वेडनेसडे 6 अगस्त को लुटन सेंट्रल लाइब्रेरी में वर्ल्ड ब्रेस्ट फीडिंग वीक और हमारी नई वेबसाइट के लॉन्च को मनाएं। मज़ीद मालूमात के लिए familyhubs.luton.gov.uk विजिट करें।
On the authority of Ibn Abbas, may Allah be pleased with him, who said, "The Messenger of Allah, may the peace and blessings of Allah be upon him, said, he who does not show kindness to the young and respect to the elder is not one of us."
हजरत इब्ने अब्बास रज़ी अल्लाह ताला अन्हो से रवायत है कि नबी अकरम सल्लल्लाहु अलैहि वसल्लम का इरशाद ग्रामी है, जो छोटों से शफकत से पेश नहीं आता और बुजुर्गों की इज्जत नहीं करता, वो हम में से नहीं है।
Biscott Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscott Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our stop smoking service. We're open 7 days a week till late, including bank holidays. Biscott Pharmacy, 157A Biscott Road, Luton. Call 457709.
Are you ready to embark on a journey of purpose and impact? The East of England Ambulance Service is recruiting now. Are you seeking training and a new career or looking for a challenge in development? Start your career for life with East. Apply now for roles in frontline emergency operations, control rooms, support services and non-emergency transport. Visit www.eastamb.nhs.uk and click Join the Team. Make a real difference. Join the East of England Ambulance Service and start your career for life.
इत्दाल, हुर्रियत और हक की आवाज़ हमेशा गालिब रही है और यही आवाज़ हमेशा गालिब रहेगी। आइए और सुनिए हक की आवाज़। मैं हूँ इमाम हाफिज इजाज़ अमन, सुनाऊंगा आपको प्रोग्राम आवाज़ हक में हक की आवाज़, हर सोमवार 11 बजे से 12 बजे तक, ओनली ऑन इंस्पायर FM 105.1।
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening, and today we are talking about urgent care services, when and why to use. with our very own two lovely guests, Dr. Chris Griffins and Julia Cochin from Milton Keynes Urgent Care Services. This program is broadcasting live today on 28th of August 2025 and the time just past 6:30 p.m. And we're broadcasting live from the studios of Inspire FM. And for our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, Bedford, Milton Keynes, and our positive airways reaching to all our listeners who are listening us through Inspire FM app, website, or viewing us through our Facebook and YouTube channel. Good evening and welcome back. Before we went on break, we were talking about urgent care services and what they can do and how they can do it. But there are a few things which I do like to know, like what are the most common cases that comes to urgent care, which should be coming to urgent care and end up in A&E, and that's the best place to ask. And who is the best person to ask other than Dr. Griffins? So, Chris, tell us, what are the common cases that should be coming to urgent treatment centers rather than A&E?
So again, if we were to kind of categorize these into different areas, so minor injury, so sprains, strains, where you're able to weight bear still and mobilize, then I would recommend urgent care. Fever that we're not kind of entirely concerned about, but fever in children and adults. And then we have the minor illness categories, so sore throats, ear infections, chest infections, urinary infections, also lacerations, cuts, grazes, burns we can manage. I would steer patients away that have presented with kind of really quite severe shortness of breath, a real heavy or sharp, severe chest pain. The same for abdominal pain. If it's really quite severe, where you're literally doubled over in pain, then generally that can indicate an acute abdomen, where the main hospital or the emergency department would be most appropriate. But yeah, abdominal pain we certainly see a lot of.
Indeed. On that note, let me introduce our listeners as well. Listeners, if you have any questions or queries regarding our topic today, which is urgent care services, when and why to use, please get in touch with us by calling us on 01582 481822. I repeat, 01582 481822. Or you can send us your questions via text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. And I did receive some text messages. Wow, I have not received text messages in ages. I did receive some today. So one of the very first text message says, what do you enjoy most about working in an urgent care settings? Which one you like to go first? Jackie.
It's good. Is Jackie here?
No, Julia.
Okay. You did that today as well. What do I enjoy about working in urgent care most?
Other than calling.
Obviously, my boss, who's Dr. Griffin. Oh, hello, Dr. Griffin. No, what do I enjoy most? The team, the people, the patients, mostly. I think it's to work in an area like urgent care or A&E or a fast-paced area that can be quite pressurising. I think you have to have a really good team around you, and probably biased, but I do think we've got a really good team around us. And I think predominantly everybody's first interest is caring for the patients and giving them the best experience that we can. And I think, because we've got that ethos, that's what makes it really enjoyable. And knowing that, improving the service as much as we can as we go along and seeing those improvements. I think for me, that would be the major thing.
Chris?
It has to be, well, it's definitely the team, of course. It's, we do have a really good team. But it's the faster pace than kind of core general practice. And also it's the element of kind of coordination of care that we can offer, or that we do indeed offer across Bedford, Milton Keynes and Luton. So out of hours, we support all the, we give advice to all of the ambulance services, all the district nursing services, all the urgent care response team, palliative care,
111 calls,
111 calls. We do the 111 appointments, or the face-to-face walk-ins.
It's quite diverse.
Yeah, it's huge. So the outreach that we provide from just one hub site is immense. Actually, we literally coordinate and support the care across the entire community. Especially.
And we can also be an outlet, can't we, as well, for patients that are having trouble with mental health as well. Often we can be that point of contact, because patients can walk in, especially with a mental health presentation. It's often very difficult for people to be as planned as to pick up a phone, call 111. But I think having that walk-in element to our service means that we can reach perhaps the more vulnerable people in society that wouldn't necessarily plan to pick up the phone, but in that moment just feel that they need some help. So I think that's an important part of the service as well that we offer. We don't have mental health practitioners as such within the building, but we can listen, we can signpost, which I think is really important. So.
In terms of another question, sorry, one of the other questions says, can I come in if I have COVID? Because we have walk-in service, so can I come in if I have COVID?
To be honest with you, Fahad, I think the COVID testing now is very different. And I think a lot of people, unless you're in those vulnerable categories, a lot of people aren't routinely testing for COVID when they get symptoms which underlyingly could be. We know COVID's still around in society. And I'm sure that a proportion of our patients that do present are presenting with COVID. But I think that the answer to that question would be absolutely. Obviously we would say that if you have tested for some reason and you are positive for COVID, then let us know. Because we could have other vulnerable people within the waiting room. So if we do know, we can make allowances and we can perhaps put things in place for you and for other patients. But absolutely, yes, if you need to be seen, you need to be seen.
Indeed, and that's really good to know, because sometimes people are very confused, especially if they have COVID. Now, you earlier did mention about red flag symptoms. Are there any specific symptoms or the red flag symptoms that means you have to go A&E always, or A&E will be the first choice?
Yes, and it really is. It's if I kind of use the term and say it's very symptom specific. So when we spoke earlier about pediatric population, we said about when might you take your child to the emergency department. So fevers that you can't control with calpol ibuprofen, reduced urine output, reducing oral intake, so hence dehydration, non-blanching rashes, stiff neck. So signs and symptoms suggestive of meningitis. So that kind of sits within the pediatric bracket. But there are kind of red flags with lots of different problems. So just let's take back pain, for example. We see many cases of back pain. But there is an emergency that we recognise within medicine, and it's called Cauda-Equina syndrome, where there can be significant pressure on the lower part of the spinal cord, and as such, patients with back pain may have changes to their urinary or bowel function, so either loss of control or even go into retention, weakness in the legs. In those cases, again, we would be going, that's a red flag, go to the emergency department. Again, chest pain, for example, heavy crushing chest pain with radiation into the neck, the arm, nausea, dizziness, etc. All red flags. We would be directing, again, go to the emergency department. We need to rule out a cardiac cause for that chest pain. Thinking of shortness of breath, again, a real significant shortness of breath, struggling to complete sentences, really struggling to mobilize, even if you're just walking a short distance, if that's causing quite significant shortness of breath, again, emergency. So those are my kind of main kind of red flags, but they're very kind of specific to different areas of the body, as it were.
Mm-hmm. And I remember you mentioned about 111 earlier, that 111 is the best port of contact to start with. What role does NHS 111 plays in guiding patients to urgent care or A&E or ambulance services or pharmacy?
So if we think of it in terms of the background, so let's say I was now a patient myself calling NHS 111, and I've called them saying that I have chest pain. Now, what the 111 call handler will do is ask you a series of questions that are kind of like a pre-built template. That template will navigate that call handler, and they may ask you where the pain is, the severity of the pain, associated symptoms, etc. And it flows through a pathway. And then subsequently, the pathway will help to determine your level of risk, and it will give that call handler different options to kind of direct you as a patient. And dependent upon where you are and what services you have nearby, and depending upon the severity of your symptoms, the options that may be available to you, it may very well be a directly bookable 111 appointment. So we offer those at Milton Keynes Urgent Care Services, or they may ask you just to self-present directly to the centre. It may be that they schedule a call back with a clinician, or it may be in fact that they say just head straight down to the emergency department. In some circumstances, they will advise pharmacy contact or own GP contact. But broadly speaking, that's the kind of the kind of pathway navigation.
Mm-hmm. Sometimes they make appointments for themselves as well, isn't it, with the GPs?
Correct. Yes.
Yeah. Okay. And on that note, let me introduce our listeners as well. Listeners, if you have any questions or queries regarding our topic today, please give us a call on 1582 481822, or you can send your questions via text messages or WhatsApp on 07779 481822. I receive another question from one of our listeners asking, can I come to Milton Keynes Urgent Care Centre even if I live in Luton?
Absolutely, yes, you can. One of the reasons why we say ring 111 first is that 111, it may be that Luton is the best place for you to go initially, but absolutely, I mean, we run a walk-in service, and actually Bedford, Luton and Milton Keynes now are all part of the same commissioning area, which is called BLMK. People may have seen that in the media. Yes, people can come to us from across those areas, and we have people come to us that are temporarily staying in Milton Keynes that are from other ends of the country. So as we said earlier, everybody will be clinically assessed when they walk through our doors. So yes.
And what if one of the other questions which has been raised by one of the listeners says, what if I was bitten by an animal like a dog or a squirrel? Could urgent care help me?
Bitten by a squirrel? Yes, we've had stranger bites than that, I would say, come through the door.
We have.
Yes, absolutely. And in fact, that's probably a good example of something that would be completely appropriate for urgent care. The likelihood of you getting in with your GP on the same day for a complaint such as that is probably unlikely now, unless you go into something called an anaphylactic shock and you have those red flag symptoms that Dr. Griffin was talking about. That would probably be very appropriate. Some bites do need antibiotic therapy. Some bites need tetanus jabs. So absolutely, yes. If any squirrel bites out there, feel free to come on down.
What about human bites?
Again, human bites, yes, absolutely.
Okay. So, in terms of urgent care services itself, so tell us about some urgent care services. Are they staffed with doctors, nurses? How do they staff, and how many staff are there? Because one of the things people do think that if they go to an A&E, you will end up seeing like 4 hours waiting time. And is that something which is quite common across? So firstly, how they staff and about waiting time.
So all treatment centres can be staffed differently. So at Milton Keynes, we have GPs, an array of kind of nursing team that could be advanced nurse practitioners, through to kind of urgent care practitioners, nursing and paramedic, with kind of background qualifications, and we have kind of healthcare assistants, clinical support workers, pharmacists as well. But not all centres are necessarily GP led, but it's dependent upon kind of area and commissioning routes.
Mm-hmm. And in terms of the waiting time, does the waiting time differs in different areas?
It will. It's as a standard kind of urgent treatment centre, we operate on the same national standards as emergency departments. So nationally, we're given 4 hours to see, treat, and discharge patients. Generally, we find our wait time is less than that. But at times it can be so busy. We do our very best to kind of work through our patient numbers. But yeah.
I think another thing to add with that as well, so your listeners, probably some of which will be aware, but it also can't be a first come, first serve service. We have to assess people for their clinical need when they come in the door, no matter what route they come in by. So it can be incredibly frustrating to be in a service like ours and think that you're seeing people that have come in after you go in first, but there's reasons for that, and there will be clinical reasons, and also things go on behind the scene. Chris touched earlier on all the different things that our clinicians have to do, so you may think, nobody's been called in for a while, but those clinicians may be maybe ringing up the palliative care team, or taking a call from a member of the community team about somebody who's died, or having to see if they've got to authorise a home visit, and doing telephone work behind the scenes as well. So there are lots of reasons why that can't be, if I came in 20 people before you, so why are you being seen next? So it is all based on the clinical need of the person coming through the door.
Mm-hmm. Now, one of the things which people sometimes find it hard to get appointment with is GP practices, and that's the time when they say, okay, I need to get seen, or I need my medication now, or I need a blood test now, or I need an X-ray now. Can urgent care center provide those things? Can they provide prescriptions, blood tests, X-rays, or dressings of their wounds, or something like that? Or do they have to go to A&E? Chris?
I think it's important, because it's difficult, because we can provide a lot of services that you've described, but the first port of call in kind of in a non same day access capacity should be via the GP surgery. But if for whatever reason it has got to the point where you need that same day contact with a clinician, then yes, we can do those things. So for example, we wouldn't necessarily offer, or a patient wouldn't necessarily come and present to us to have a routine dressing change, but if there was exceptional circumstances, by where something had happened at the surgery that day, then we can offer those functions. Generic blood tests in terms of routine tests, no, we don't offer. We have very kind of specific markers that we check for that are largely based around infections or clots like DVTs. Again, they're very specific tests. So routine tests for things like tiredness and fatigue, again, it all has to go through the GP surgery. Same with routine referrals, all has to go through the GP surgery. If we have an urgent presenting complaint, like an urgent abdomen or something along those lines that needs to be seen by that team today, then we can refer for that day. But it's for acute problems, not for the routine.
Okay. And how do urgent care team ensure that the patients are safely directed to the hospital if the condition is worsened? Julia?
Yeah, I mean, I think a lot of that, we have various routes. I mean, some people, even though their conditions have worsened, are still safe to take themselves or for their relatives or friends to take them to A&E. We will sometimes get ambulance transport to take people from us to A&E. In certain circumstances, we may take people ourselves to A&E. So, I mean, just rest assured that if A&E is needed, we will make sure that the clinically safest way possible is to get people there.
So for people who don't drive, now that's one of the biggest problem comes in play. Whether you are living in Luton, Bedford, or Milton Keynes, it's not easy. So how easy it is transport wise, and what kind of a support available for people to help access the urgent care services in their locality?
So if we take kind of the example of like a housebound patient, they may or may not already be under community care services. So all areas, including Luton, will have a dedicated community nursing team, an urgent care response team. So these clinicians will manage things in the community like cellulitis, urinary tract infections, falls, etc. If we have a patient that's not already under one of those services, again, you'd be accessing urgent care services remotely through 111, and then there's remote clinicians that will kind of talk to you over the telephone. If that clinician deems it appropriate for a face-to-face contact to take place, that clinician then has to make the decision whether or not it's appropriate for example, a paramedic to go out and assess that patient if they are quite unwell, or if it's less acute but needs contact, it might be that an urgent care clinician comes out and undertakes a home visit assessment. So that's the main kind of route and approach if we had a housebound patient.
And on that note, I must say, wow, the time has passed so quickly. We are just coming to the end of our show tonight. So finally, what advice would both of you will give to the people of Luton, Bedfordshire, Milton Keynes, which is BLMK, about making the best use of urgent care services? Let's start with you, Chris, this time.
I think the biggest message, which we've partially touched on, is to be mindful of everyone else that's accessing kind of similar services, on the basis of trying to use the most appropriate service for your medical complaints and ailments. And where we can avoid emergency departments, do so, and then it enables them to have more capacity to see unwell patients, because it may very well be that one of our loved ones needs emergency care, but if it's not being used for the most appropriate thing, it can be quite detrimental. But yeah, so it's just that kind of broader, wider knowledge and understanding, and everybody just caring.
Absolutely.
Julia?
No, I wholeheartedly echo that. I mean, I think that also, although I know that often the people that haven't had good experiences with the healthcare system, you often hear about those more. But I think it's true to say that far more patients have good experiences of the emergency care system, urgent care system at A&E than they do bad. I know the waiting time is longer than anybody would like, but people are still being seen. I think from an emergency and urgent treatment perspective, we do have one of the best systems in the world. And I think, just be assured that, we have really good clinicians that care very much, waiting to see people who need to be seen in the right place.
On that note, I must say thank you so much for both of you
Thank you.
to attend this session and share your valuable knowledge. And until next week, I'm your host Fahad Matin saying Assalamu alaikum.